Hello, everyone. Welcome back to the Pharmacology Masterclass by Dentospedia. It is one of the trusted platform for dental board examination preparation. Myself, Dr. Drishti Jha. Now we will be starting with our second topic, that is diuretics in a brief way. So let's start. What do you mean by diuretics? Diuretics are the drug that increase the urine output. This is very important. It increases the urine output, promoting the loss of water and electrolytes so that there is a decrease in BP and other factors. They are used to treat hypertension, very common, most common, heart failures, chronic kidney diseases, cirrhosis, and edema. Edema is basically fluid retention. You must be knowing. It can lead to swelling, so eventually it is called as edema. They act on the different parts of the nephrons affecting specific ion transport mechanism. Dental relevance can cause xerostomia. Dry mouth may lead to orthostatic hypotension, can cause lichenoid oral reactions, and may interact with epinephrine and local anesthetics. So important to consider for safe dental management of medically compromised patient. So these things are the side effects, and we have to be monitoring if the patient comes with the medication of diuretics. Now the classification of the diuretics very important. By nephron site. Okay. Diuretics are classified based on their site of action in the nephrons, where they inhibit specific ion transport mechanism to alter the electrolyte balance, urine transformation, clinical use and side effects and dental implication. So it is one of the most important topic in this chapter. Now, the first type is the loop diuretics. It, for example, furosemide, butamide, torsemide, they act. This can also be your MCQs, the site of action. They act on the thick ascending limb, and it inhibit the sodium, potassium, chlorine symporter. Okay, this is also very important MCQs. And the key effect is that potent diuresis and decrease in sodium reabsorption. So, for understanding this table, you must be thorough with the tubular transport in renal physiology. Okay, so if your physiology is done, then it will be you need to revise that tubular transport. If not, then in physiology you will be understanding about the tubular transport, then you will get a clear idea of this classification. For the pharmacology section, you just need to remember the examples, nephron site, MCQs, mechanism, and the key effect. Moreover, this table is very important. Second is the thiazide. Example, hydrochlorothiazide, chlorothalidol, indapamide. It act on the early distal tubule. It inhibit the sodium chlorine transport. Symporter. Okay. It have moderate diuresis and vasodilation. Third is the potassium sparing diuretics like spironolactone, amiloride. It act on the collecting duct and block the ENaC or aldosterone receptors. They have the effect of mild diuresis and sodium potassium retention. Okay. And fourth is the carbonic anhydrase inhibitors. The example most common is the acetolamide. It acts on the proximal tubule. It decreases the uh, hydrogen secretion and decreases the sodium and bicarbonate reabsorption. So it has weak diuresis and metabolic acidosis. It is also very important. And fifth is the osmotic diuretics, that is mannitol, most commonly used. It acts on the PCT and descending loop. It inhibits the water reabsorption and water reabsorption osmotically, and increase the urine output by decreasing the intracranial pressure. Intracranial pressure. Basically, this is used for any head trauma. This mannitol. So this table is very important. You need to know it. Now just a diagrammatic representation of the tubules of the kidney. So here is the Bowman's capsule, glomerulus is there, okay. Then PCT comes, proximal convoluted tubule. Then we have loop of LA, descending loop of LA, ascending loop of LA. Loop diuretics act on the ascending loop of LA, that is a thick ascending loop of LA, thick ascending loop of LA. Then we have distal convoluted tubule, and where the thiazide diuretics act, it act on the sodium chlorine symporter. And loop diuretics act on the sodium potassium chlorine symporter. And here in the PCT we have carbonic anhydrase inhibitors. And when we go further, we have collecting duct where potassium sparing diuretics act, blocking this sodium transporter, and basically there is increase in urine output. That is the work of diuretics. Okay, so this is just a brief review through diagrammatic representation. You need to remember the table which I showed you earlier in the slides.
So thank you so much for watching. I hope you liked the video, and please download our app Dentospedia for more structured and curated module for pharmacology. Not only pharmacology, every subject you will be getting here in a very structured format, from video lectures to quizzes to mock tests to everything that you need for your examination that will ace your preparation. So thank you so much and happy learning.